Okay. Okay.
Okay, do you have auto, are we doing an auto transcript?
Yeah, there's no captioner today.
Okay, so we can do auto. Trying to, gave me the option a second ago. Enable auto transcription, okay, cool. And then George, let's see, am I making you the host again or Joyce?
You can make me a host. I don't know. I can't remember what we normally do.
Yeah, and then you can make me co-host so I can jump back on if needed. Because I have to go back to another meeting.
Okay.
But do you have my cell phone number? I was gonna say that.
Can you email it to me?
Yeah, or Cecily, I see she's on, maybe she could, I mean, just contact me if, if it goes down. But can you go ahead and make me co-host?
Oh, sorry. Okay.
I'll put my number in the chat. I don't know if it'll get buried, but
Oh, okay. No.
I'll email it too.
I got it. Good morning. We'll get started in a few minutes.
And the captions look good on YouTube.
Great.
Hey, Kim. Hey, George.
Rick, how are you?
I'm really
Good
well.
to see you, Rick.
Good to see you, Kim. Been a long time.
Too long.
You're at the office I see and still mask.
Good.
So just to let you know, we are live streaming and I'm going to turn on the recording. Find it. Okay.
Get everything up here. Let's see. There. All right.
Morning, Annette.
Good morning,
Hi there.
everyone.
We're good.
Well,
I am so far. When I first got on, it said the host wouldn't let me unmute myself, but then eventually I could. So some people may have that problem too.
thanks, Karen. Should be okay. I don't know. We had some small issues at the beginning. But
Yes, if they're resolved by now, they were very small.
Morning, Laura.
Morning.
All right, well, it's 10 o'clock. Welcome everybody to the quarterly meeting of the Alzheimer's Disease and Related Disorders Commission. There's still a few people popping in, but I'm going to go ahead and get started with the housekeeping announcements. Find them. Okay, so due to the active state of emergency, this is an electronic meeting pursuant to item 4.0.01G of the 2021 Appropriation Act and section 2.2-3708.2A3 of the Code of Virginia. Meeting notice has been provided. The meeting is being recorded and minutes are being taken. All votes will be conducted by a roll call of voting members, as this is an electronic meeting. Meeting materials have been posted under the Alzheimer's Disease and Related Disorders Commission's quarterly meeting tab at the link posted on the slide. Advance my slides, there we go. Members of the public are able to live stream this meeting via the DAR's YouTube page. Please be advised that if the live stream is interrupted, we'll need to pause the meeting until it's restored. Public comment will be accepted by email or phone to my attention. Public comments that were received by March 7th, yesterday, 2022, will be read or, if lengthy, summarized during the meeting when we reach that agenda item. So I'm not going to walk you through the Zoom functions. I think everybody is very familiar with those by now. But I will remind members just to keep your microphone on mute unless you're speaking. This helps reduce background noise. And also, if you can, please state your name when you do speak. This helps your colleagues on the commission know who's talking, and it also helps Cecily with documenting the minutes. We don't have a captioner today, so there are no closed captions, but they are available on the YouTube stream through auto captioning. Members and guests, if you have your video enabled, please be aware the system may capture your image and video in the public streaming and recording. Please only use the chat feature if you have a technical issue or other issue not related to the business of this meeting. Chat comments aren't captured in the live stream or the recording and so are not available to members of the public. You may also use reactions to do a thumbs up for agreement, or you can raise your hand to speak. Although this feature may not be used in place of a verbal vote in a roll call vote. So for all votes, we'll do a roll call and you'll be asked to indicate your support. with an A or a yes, opposition with a nay or a no, or you may abstain. I'd like to thank the DARS video teleconferencing team and the DARS communication team for making this electronic meeting possible. So I'll do a roll call of members in alphabetical order to confirm attendance. Laura Bowser.
Here.
Travania Brown Hughes.
Here.
Sheriff Vanessa Crawford. She had a funeral to go to, so she may not be here. Karen Darner.
Here.
Chris Desimone.
Here.
Karen Garner. Rick Jackson.
Here.
Kim Cutner.
Present.
Destiny Levere Bowling.
Here.
Carol Manning.
Here.
Lana Sargent.
Here.
Margie Shaver.
Here.
Pam Teester.
Here.
Isham Williams.
Here.
Great. So Laura, we do have a quorum. I will turn it over to you. And let me
All
pull up
right.
the agenda.
Well, good morning, everyone. It's wonderful to see you at least electronically. I know that we briefly had one in-person meeting last time, and now we're back to electronic. I don't think we will end up being electronic the next round, but it's nice that we can at least take part of it now. So I wanted to go ahead and call the meeting to order. So it's 10:05. And then go through and just do a brief round of introductions. I know there some folks weren't able to make the last meeting, and we have several new faces. And also it just helps us to kind of launch into the session. So I will start. My name is Laura Bowser. I am chair of the commission. I've been on a member of the commission now for, I think 6.5 years. My background is consulting, and what brings me to the commission is that my mother passed away with early onset Alzheimer's 5 years ago. And since then, I've done a lot of volunteer work with the Alzheimer's Association in Richmond. And George, if you want to just go ahead and roll call again, and then I'll let everyone introduce themselves.
Great, thanks, Laura. So I'll start with members, and then I'll call on guests to introduce themselves. Travania Brown Hughes.
Good morning, everyone. I am Travania Brown Hughes. I am an assistant professor at Hampton University. Although I am in the School of Pharmacy, my background is in gerontology. And actually, I got my PhD in gerontology from the University of Kentucky, where I was honored to work with Dr. Pam Teester. Let's see here. I've been on the commission now for 2 years. My father is in the mild to moderate stage of Alzheimer's disease. So it's getting more and more interesting every day. I also do research, particularly in cognitive aging in minority populations. I'm honored and glad to be here. Thank you.
Thank you. Karen Darner.
Hi, I'm Karen Darner, and I think this is my 4th year on the commission. I came on just at the beginning of the Northam gubernatorial term. And I had a mom that I retired from the school system to find out what in the world was going on, because she had multiple problems. And one of them turned out to be dementia. And so I was able to stay with my parents in Arkansas. I live in Virginia. So it was a good gift to me as far as being able to be with them. It was tough and challenging, as everyone I'm sure is aware of. But, and she passed away 10 years ago. I stayed until my father had passed away as well, and came back to Arlington and have been involved in the Alzheimer's Association, lobbying our member of Congress, Don Beyer, as well as other activities associated with the commission. I have a brother also, Kendall, who was diagnosed with dementia in 2013 and passed away as a result of the COVID-19, and an employee who had caught the disease and was going between two memory care units in Denver. But I have a deep place in my heart for both of those folks, as well as working with you all. Thanks.
Thank you. Chris Desimone.
I'm Chris Desimone. I'm president of the law firm Anderson, Desimone and Green. We're a little small estate planning and elder law firm headquartered down in Roanoke. So we have countless clients that we're helping in various forms of dementia. This is my 8th year as a commissioner, actually, and I just want to say thank you to all of you. The wealth of talent on this board is amazing. I never realized how little I knew until I sat on this board, because I only handle the legal end of things, and I've learned so much on the medical side and the care side, and now I can be an envoy for all of you going out there after my term ends. But thank you. I think this might even be my last meeting. I think the next meeting there might be somebody else, George, right? So I think my 8 years are coming to a close, either this meeting or the next one. But just know how much I appreciate all of you. You've done incredible work.
Thanks, Chris. You do have one more meeting.
Okay.
So we'll see you in June. Rick Jackson.
Good morning, I'm Rick Jackson. I'm the retired executive director of the Riverside Center for Excellence in Aging. I think this is my 5th year on the commission. My personal connection to it is that my mother was diagnosed with Lewy body dementia, and obviously I watched that take its toll on her. I'm presently serving as chair of the training work group and the legislative committee, and I've enjoyed every minute of it and looking forward to this year as well.
Thank you. Kim Kuttner.
Hi, good morning. And I've had the pleasure of working with Rick Jackson at the Center for Excellence in Aging and Lifelong Health. Of course, what brought me on this journey is the personal connections with family members at a young age and now. So this is such meaningful work on a daily basis. It's different providing care for others and also for families, a different challenge. But so I'm involved with community-based care coordination, education, support, training is a big piece, and research and translational research that is bringing work to the community, to acute care, and to our lifelong health. So it's such an honor and pleasure to get to work with each of you.
Thank you. Destiny Levere Bowling.
Hi, good morning. I'm Destiny Levere Bowling. I'm currently a communications director for Virginia AFL-CIO, and I've only been on the board a few months. But what brought me to wanting to be a part of the board was that dementia and Alzheimer's run in my family quite a bit, actually. And I was caregiver to my grandmother who had dementia and recently passed in December. So here I am, willing to do the work and wanting to advocate for people like those in my family. So.
Great, thank you. Carol Manning.
Good morning. I'm Carol Manning. I am the director of the Memory Disorders Clinic at UVA. And I don't know how many years I've been on this board, but I'm really impressed by all the enthusiasm and the young people. Destiny, welcome. It's great, great to see new people on. And George, when am I over? Do we know that?
I think it's next, might be next year or the year after.
Okay, so I'm still good. You're going to have to put up with me for a little while longer. I both have family members who had dementia, who had Alzheimer's disease, but also spend my days here at UVA as director of the Memory Disorders Clinic, working not only with people who have the disease, but also their family members. And I care deeply about the caregivers, especially unpaid caregivers, who really are devoting their lives to caring for people who have the disease. Our program here really focuses on providing care to the entire family, and especially people of color who are at increased risk for dementia and often do not have access to resources that can be so helpful. So that is currently the focus, and I'm happy to be here. Thank you.
Thank you. Lana Sargent.
Hello, everyone. I'm Lana Sargent. I wish we were in person again, but this is nice to at least be meeting. I'm vice chair of the commission. I've always been an honor to be here. I have both a personal and professional connection with Alzheimer's and Alzheimer's related diseases. My professional connection is that I'm an assistant professor at VCU School of Nursing, and I have a clinical practice in geriatrics. I also spent about 45% of my time in the Center for Alzheimer's and Related Diseases for the past actually going on 4 years now at NIA, and do a lot of work to try to translate research into the clinical setting to really make it matter at the bedside. As a nurse, that's what matters to me. And then at a professional level, a personal level, I have many families with vascular dementia, and more recently, my mom was diagnosed with early Alzheimer's. So it just continues to persist, but hopefully we can make some ways. It's been an incredible honor to be a part of the work here, and I'll still be doing some of the work group things on data and research, and I hope that we'll continue to be able to, and I hope you all will maybe consider joining the group, getting some new members this time around. We did just recently get some funding to start a registry. So we hope that will also help the commission in those efforts. Getting numbers and getting information is always really difficult. So we need all of your minds and getting that going. That's my plug for the work group. And otherwise, I'm happy to be here with you today.
Great, thank you. Margie Shaver.
Sorry. Good morning, everybody. I'm Margie Shaver. I have a background in marketing. I am now retired, but marketing is what I did all of my adult life. I've been on the commission, I think, about a year. Is that right, George? Give or take. Is it 2? 2 years? Oh,
Yep,
God, time goes by. Oh, wow. Anyway, I still feel like a newbie. My personal connection to Alzheimer's is my mom, my grandmother, and 3 aunts all had Alzheimer's. I have been a volunteer with the Alzheimer's Association for probably about 20 years as an advocate, board member, an ambassador, walk committee, kind of a jack of all trades kind of person. And now I'm here and glad to be here.
Thank you. Pam Teester.
Hi, thank you for calling on me, George. I ran to my CV to see that I've been on the board since 2019. Otherwise, I would be like Margie and not have a clue about how long that's been, or where I was sort of in the queue. So I'm a professor, and I'm the director of the Center for Gerontology at Virginia Tech. I probably maybe I'm one of the few people on the board who don't really have a person in my family life immediately that has had to deal with issues of dementia to a great extent, but I do have studied it on my entire scholarly career. So I have worked in the space of surrogate decision making. Chris would know about that. Powers of attorney, guardians in particular, healthcare surrogates. I've sort of looked at that component. I've done a tremendous amount of work on, well, not necessarily tremendous, but I have done a big amount of work on elder mistreatment and vulnerable adult mistreatment. And I am probably now, I will call myself a bioethicist. So I'm a researcher, a theorist, and a bioethicist. That's probably the best I can do.
Great, thank you, Pam. Ishan Williams.
Good morning, everyone. My name is Ishan Williams. I'm on faculty at the University of Virginia in the School of Nursing, although my PhD is in Human Development and Family Studies. And so I've been doing a lot of research with older adults and older adults with dementia and their family caregivers, and primarily looking at populations that have been often marginalized or not able to access treatment and diagnoses. And so looking in rural populations as well as underrepresented populations like African-American communities. So happy to be here. I think I'm in my second year. Those years just start to, I think the pandemic is what we can blame this all on, right? Everybody's just like, we've been here forever, but feeling like the pandemic has taken some time away, but happy to be a part of this group. It's one of the highlights of my job. So I'm really happy to be a part.
Thank you. So I'll call on guests. Marcia Dubois.
Good morning. I'm Marcia Dubois. I am a Deputy Commissioner at the Department for Aging and Rehabilitative Services, or DARS. Like many of you, I too have been personally impacted. And like Chris, I just want to thank the Commission for always being passionate and dedicated. I find this Commission to be one that I just love attending because it's always sort of vibrant and everybody's excited to be here. So thank you all for your work.
Thank you. Annette Clark.
Good morning, everyone. I'm Annette Clark. I am the older adult specialist with the Department of Behavioral Health and Developmental Services. I came on board in September, so I'm relatively new at that. I can tell you a little bit about what I do there if anyone would like to learn more about that. But some of you may recognize me from my 17 years of work with the Alzheimer's Association. And then prior to that, I worked in an adult day setting. So for my 36 plus years, I've worked with individuals living with a dementia diagnosis. And I too am honored to be here, even as a guest today.
Thank you. John Carpenter.
Good morning, everyone. My name is John Carpenter. I am the Director of Administration for the Division of Community Living at DARS.
Thanks. Catherine Harrison.
Good morning, everybody. Thanks for having me here this morning. I'm very pleased to be here. I'm Catherine Harrison. I am the Director of the Division of Policy and Legislative Affairs.
Thank you. Josh Myers.
Good morning, Josh Myers. I'm the Government Affairs Director for the Alzheimer's Association in Virginia. I've been with them coming up on a year almost now, and I'm just excited to get back to doing this type of work with the Commission, where the real work done as the legislature winds down and we get the important stuff done.
Thank you. I think that's all the guests and then staff. So I'm George Worthington. I'm the Dementia Services Coordinator at DARS, and I'm staff to the Commission. I also have personal experience. My mother-in-law lived with Alzheimer's disease for about 20 years until it killed her about a decade ago. So I certainly saw the impact on the family, and the more I think about it, her whole community. She lived in a very small town, and it really impacted the community. And Cecily Slaser. So, Cecily.
Good morning. Can you hear me?
Yes.
Okay, sorry. I'm Cecily Slaser, going into my 29th year in aging, and I provide admin support to our 3 aging boards and program support.
Thank you. All right, I think that's everybody. Laura, I'll turn it back to you.
Yeah, thank you. I just want to reiterate what Chris, Dr. Manning, and so many of you said. I think it's just amazing how much passion that our commission has, and it's always just a wonderful conversation with you all. And I too agree that we just have COVID brain. None of us know how long we've been on the commission, but hopefully that will fix soon when we can get back in person. Okay, so we actually have a jam-packed agenda today, but as usual, we want to start with a reminder of why we're here. So as defined in Virginia Code, the role of the Alzheimer's Disease and Related Disorders Commission is to, 1, examine the needs of persons living with Alzheimer's disease and related disorders, as well as the needs of their caregivers and ways that state government can most effectively and efficiently assist in meeting those needs. 2, develop and promote strategies to encourage brain health and reduce cognitive decline. 3, advise the governor and General Assembly on policy, funding, regulatory, and other issues related to persons suffering from Alzheimer's disease and related disorders and their caregivers. 4, develop the Commonwealth's plan for meeting the needs of patients with Alzheimer's disease and related disorders and their caregivers and advocate for such plan. And 5, establish priorities for programs among state agencies related to Alzheimer's disease and related disorders and criteria to evaluate those programs. And with that, I want to go ahead and move to review and adopt our meeting agenda for today. We need to go ahead and approve the agenda, which requires a vote. And I'm going to open it up to the floor to see if anyone has anything that they want to change or amend. But before doing so, I want to go ahead and propose that we do take out the second public comment section. I believe, George, we just had that in there in case we were in person.
Yeah, that's right.
Does anyone have any other amendments to the agenda? If not, then I will open it up to vote.
We need a motion to adopt the agenda with that amendment.
Karen Darner, I move to adopt the agenda with the amendment.
Kim Cutner, second that motion.
Thank you.
Thanks. So I'll call a roll call. Laura Bowser.
Aye.
Travania Brown Hughes.
Aye.
Karen Darner.
Aye.
Chris Desimone.
Aye.
Rick Jackson.
Aye.
Kim Cutner.
Aye.
Destiny Levere Bowling.
Aye.
Carol Manning.
Aye.
Lana Sargent.
Aye. Sorry about that.
No worries. Margie Shaver.
Aye.
Pam Teester.
Aye.
Sean Williams.
Aye.
Okay, so that was a unanimous vote to approve the agenda, approve and adopt the agenda as amended.
Perfect. With that, then we will go ahead and review and approve the minutes. And actually, the minutes were actually quite long because we had an in-person meeting last time, which was nice. But I want to just go ahead and ask if there are any changes. If not, then the minutes are adopted as presented.
It's quick.
And George, this is now when we have public comment. Did we have any public comments?
No, didn't receive any public comment this time, Laura.
Okay. Well, then with that, we've moved through the administrative section, and I'm going to go ahead and turn this over to Deputy Director Marcia Dubois for the Division for Community Living report.
Well, hello again. I have a few updates for you, but I understand you all have a packed agenda, so I'll try to keep it brief. So Virginia Grand Driver is taking a new approach to promote safe driving among older adults. Toward that end, we've created the Rad Driver Totally 80s Workout Tape, a series of short exercise videos designed to help older adults improve coordination, flexibility, and maintain strength to drive safely. I will be getting that video link out to George to share with you all. And I encourage you to please share the exercise series with your community if you so choose, and help us promote the videos and other resources available through Virginia Grand Driver. The exercises led by adult group trainer and personal fitness trainer Wendy Chin are approved by an orthopedic doctor and physical therapist. Also, updates for our No Wrong Door program. The No Wrong Door team did revise its rec card to include information on No Wrong Door Direct Connect and the No Wrong Door Person Center portal, Virginia Easy Access. In the past, this rec card was just in print format, which still exists, but we also have updated a current version to be available electronically, and I will also get this to George so that you all have access to that. Also on the No Wrong Door front, the online journal Social Work Today featured Virginia No Wrong Door in an article recognizing it's being one of 2 winners of the Administration for Community Living's Mental Health Innovation Challenge, which was issued to bring together entities helping to address the dual issues of social isolation and loneliness. Working together as co-winners of the challenge, Virginia No Wrong Door and United Way Worldwide are bringing together an assessment tool individuals can use to determine if they are at risk of social isolation, and an electronic means of connecting individuals at risk to organizations and services that can be of assistance. Sarah Link, our No Wrong Door director, is quoted in the article as saying, "One result of the vast number of resources is that they are sometimes underused. 27,000 is all of the services available in Virginia Navigator, although not all are for social isolation and loneliness. People aren't always aware of even things like area agencies on aging. They exist across the country as a whole network, and they were funded under the Older Americans Act, which was signed into law in 1965. There are 25 in Virginia." Under both the leadership of No Wrong Door and United Way Worldwide, the goal is to increase awareness of such resources while decreasing social isolation and loneliness across the Commonwealth. So we're super excited that we got that recognition once again. That was a national featured article. On our nutrition programs, I wanted to offer some highlights from Virginia Market Fresh, Virginia's senior and WIC Farmers Market nutrition programs. Our 2021 season data is complete. So just wanted to share with you that overall Virginia had total redemption rate of 80%, which is pretty good. Senior Farmers Market nutrition finished the year at 83%, whereas the WIC finished the year at 59%. There were 198 authorized farmers that sold their goods at 66 farmers markets and 27 roadside stands. So kind of keeping in mind that we were still during COVID throughout this period. Senior Farmers Market reached 10,254 participants, and WIC reached 3,939 participants. 503 pregnant women and 235 breastfeeding women were among those who received support. Virginia received expansion funds in both senior and WIC farmers markets. With that expansion funding, brought Central Virginia Alliance for Community Living into the program on the senior side and Cumberland Plateau on board for the WIC side. We saw new success this year with partnerships between growers, nonprofit farmers markets, and housing facilities where mobile markets were strategically placed to reduce transportation barriers in at least 2 new areas of the state. We also welcomed Harrisonburg and Lynchburg into the program. In other news, DARS has received a waiver of the limitations placed on the amount that may be expended for home modifications as stated in the Older Americans Act regulations. This request was based on the fact that due to the higher cost of materials and supplies since the federal regulations were put in place, the current limit of $150 is insufficient to adequately and meaningfully address identified home modifications. As you all can probably imagine, that is very insufficient. The Administration for Community Living, or ACL, granted a waiver of the limit on these home modifications under the Older Americans Act for area agencies on aging, and allowed us to increase that cap up to $500 per client, with an exception to go up to $1,000 with our approval. So we're very pleased about that. Even $1,000, as you all can imagine, with the cost of supplies is a little bit of a drop in the bucket. But before, since the limit was $150, we feel like that's a step in the right direction to make some modifications for older adults in our community. So we're very pleased about that. And then finally, expanding the public health workforce. The Administration for Community Living issued a new expanding the public health workforce within the aging and disability networks. This funding opportunity is to help cover the cost of staff to conduct critical health activities. Professionals funded through the program may provide a wide range of health services and supports, including culturally affirmative and linguistically accessible information, assistance with accessing vaccines, including boosters, and connecting to other services, transition and diversion from high-risk congregate settings to community living, health and wellness programs, activities that address social isolation and social determinants of health, and other activities that support public health and well-being of older adults and people with disabilities. So some of the networks within DARS or within our Department for Aging and Rehabilitative Services that have received some of this funding or have applied to receive some of this funding are our statewide independent living council. Some of the programs that receive funding under there, our No Wrong Door system, our state assistive technology program, which is called VATS, and our area agencies on aging, as well as our brain injury program through its traumatic brain injury grant. So that's quite a few within our agency, and we hope that that will have a good impact. And that is it, unless you all have any questions for me.
Well, thank you so much. That's all positive and wonderful to hear. And I don't know if anyone has any questions for you. But I appreciate you bringing up the social isolation, and Sarah Link, who will be actually speaking to us later in today's programming. George and I were talking when we were thinking through who we wanted to bring in, and I know some of us have heard Sarah present about No Wrong Door, but I know we have so many new members, and that's such a powerful resource. So I'm excited to be able to have her present to everyone that's new, so that we can have a wonderful conversation.
Thank you.
Does anyone have any questions?
I just had a quick question. Is there a cost for the video? I think that would be a wonderful tool to be made available to area assisted living and also independent living facilities.
The Grand Driver video?
Yes.
Not at all. Please share freely, and I will get it right to George, and he can get it out to all of you.
Okay. Thank you.
Mm-hmm.
That's what I was going to ask too. If there was a process that we could get a copy and share it with folks. I take the AARP program that helps reduce your insurance and remind you of some of the laws and how they've changed. But this sounds terrific as well. So
thank you for your interest. We're delighted to hear it, and we'd love for you to share it. Our Grand Driver program is a grant that we have through the National Transportation and Safety Administration. I think I got that right. I might have missed a letter there. And through DMV as well. So we do that program in partnership with them, and this development of this video was part of that. And so we'll be happy to get that out to you all.
Great, wonderful. Okay, I think then if there are no other questions, then we'll move into our legislative update with DARS with Catherine Harrison. Welcome, Catherine.
Thanks for having me here this morning. So hopefully we're in the final stretch here. If they were they're sort of winding up their legislative work this week. The big reveal will be the budget towards the end of the week. And I'll talk about that sort of at the end, but I'm not going to sort of really rehash every bit of legislation that might be of interest, because, through the process, there are a number of bills that die. So there are only a few that I'll, briefly mention in regards to that. So I'm going to try and focus more on the ones that are still alive and breathing, so to speak. So although I will, for the guardianship, be talking about a couple of different components, because I think that that's also going to be coming back next year. So I know a number of you are familiar with the Joint Legislative Audit and Review Commission did a huge report on guardianship this year and did a deep dive on that. So there were a number of pieces of legislation that came out from that report. And sort of, it was interesting, the Senate took more of, they had like an ombudsman bill that put all these different components in this one bill. On the House, you had multiple bills with varying components in them. But to give you sort of a flavor of the different components that were either included in the separate House bills or in the big sort of McPike's omnibus bill, they included things such as required training for guardians within a certain period of time after the initial order. DARS would have been required to have provided that training to them. It also increased DARS's responsibilities in a number of areas, including providing training to the local departments of social services about the expanded guardianship reports, creating or doing a report on a potential program for visitations. This would have been modeled off of a pilot that was done in Northern Virginia, where the local Department of Social Services made visits to individuals who were under a guardianship order. It would have, there's also language in there about improving reporting, department reporting for guardianships. Also, this would have been really huge, would have been sort of creating almost a navigator type of a program at DARS where individuals could contact DARS with complaints in regards to the guardianship process. So there were also changes to the guardianship annual report. There were requirements about how frequently a guardian would be required to have in-person visits with the individual under the guardianship order. And they also had additional requirements in there through the various substitutes and everything else that were bounced around about if they hired people, how many of those visits could be done by somebody who was contracted. They also had, and originally the original suggested amount of time was an in-person visit once every 3 months. Also a requirement, some of the bills addressed periodic reviews by the courts, which would have required an initial review after the initial order of 1 year, and then every 3 years thereafter, unless in the initial order it was determined it wasn't needed or they set another schedule. There was also language out there about when a guardian restricted visitation or an individual's access to someone, and about the requirements that need to be followed about notifying the individual and notifying the courts and notifying the local Department of Social Services as well in regards to that. Also about notice of the hearing when an individual is going through that process of going under a guardianship order, and about who that's to be sent to, and about notifying them of their rights to plead in that. Requirements around the guardian ad litem and what their responsibilities were about reporting about whether other alternatives such as support decision-making were applicable or good options, as well as providing the court with, if the individual, the respondent, the individual who is potentially going to the guardianship order wanted to have counsel, providing notice to the court about that as well. So there's sort of all the things that they touched on. And out of all these things, what's still surviving is that we have in the House, there are 3 bills. House Bill 623, Delegate Hudson's, deals with the guardian ad litem and making sure that they let the court know if the respondent requests counsel, and also providing more information about why or why not other alternatives to guardianship may not be applicable or may be applicable. House Bill 1212, which was delegate classes, deals with the notice of the hearing and also letting people who may be of interest, it may be of interest to them, and they are on the pleading, that they have the option to also contest or to put themselves forward as a potential guardian. This addresses the issues where there may be people who would have wanted to serve as guardian, or for whatever purpose, basically getting more eyes and more interested parties in there to make sure that the rights of the individual are respected. In House Bill 634, which was Delegate Rome's, and Delegate Rome had a number of bills dealing with a number of these other components, but this is the only one that's left. And it actually originally dealt with the visitation requirements, but what it ended up becoming is a Section 1 bill, which requires DARs to convene a work group to look at the visitation requirements and the frequency and some other options with that. Senator McPike on Senate Bill 514 carried the omnibus version, and that, as it stands now, incorporates the garden ad litem provisions from the House bill and the notice of the hearing from the House bill, and then also makes several changes to the annual report that the guardian is required to file with the local Department of Social Services. And it sort of beefs up what the guardian is required to report. So, for example, they will now have to include, if they've restricted someone's visitation, who's been restricted and why they implemented that. Also more information about doctor's visits, social activities, and number of visits, and if the guardian didn't make the visit, who was making the visit for them, those sorts of things. There was also a bill in which did not go through, but it was based upon that navigator type of thing, but it was focused on the public guardianship program, House Bill 94, which was Head's bill, and that's not alive. And then we have House Bill 96, which has gone through. It just passed both houses, which requires a decennial review of the public guardianship program ratio of staff to clients. Right now it's 20-1. So that would start off with the initial review in the upcoming year, in this year, and then 10 years from now, we'll have to do another one. So before I move on to other topics, do folks have any questions about those? I know that was kind of a lot of moving parts there.
Go ahead, George.
No, go, Pam.
Okay. So probably there's nobody on this commission that has a deeper interest in this sort of stuff than I do, Catherine. So I would say you get to do an evaluation of that program. It's long overdue. And so I think that's a tremendous opportunity for seeing how DARS is positioned. DARS would be regarded around the country as a Cadillac program of public guardianship. And man, I hope it can stay that way. These significant rights that you're hearing about, probably nobody better than Chris can tell you that individuals under guardianship are reduced to the legal status of a child. You can't contract, you can't decide who to marry, you can't take drugs you choose to or not to take. So the losses are significant. A lot of this is fired by the fine work of the JLARC committee that I am very aware of and have read the entire report. And so I'm glad to see that the annual report of the Guardian is just a total mess. Any of you researchers who would try to code that thing, it would be like a Ouija board of the answers that are provided. They're just not good. They aren't. And so I just tried to recode them again. They're terrible. And so I'm glad to see those changes are coming around. I hope there'll be more. Thanks for a comprehensive report. I loved it. Thanks.
Well, I expect next year we'll probably see folks try again with more. Thank you. George, I saw your hand.
Yeah, I just had a quick question, which is a little bit tangential, but I was just wondering, I know the JLARC report had said there's roughly 12,000 people under public and private guardian orders. I might be out by about 1,000. I just wonder if we have any way of finding out how many of those people have a diagnosis of Alzheimer's disease or another form of dementia. I don't know if that is on the annual report. I know I've had a look at it, but I can't remember
It could be, George. It could be that they mention it, but it's harder than it's probably, and we're using this term, doing some national work on guardianship that friends of yours and mine are doing. And we would call that trapped in the petition. That would mean every single petition would have that information, but it's not necessarily in the annual report. Those are Paige McCleary will tell you those are done sort of sketchily.
Okay. So it would be difficult to find out that number is what I'm hearing.
But not impossible.
Okay. Just need some dedicated and diligent researchers, I guess.
You have them in this state.
Okay. All right. I might follow up with you on that, Pam. Thank you.
So the next batch deals with APS and financial exploitation. House Bill 95, which was Delegate Head's bill. He had two, House Bill 98, which was an APS registry bill as well. Then House Bill 95 provides clarification. And I think in some instances, we had financial institutions which were had concerns about providing records during APS investigations. And this sort of beefs that up and says, yes, you are to provide those, and incorporates some references to the Graham-Bleach Biley Act, which is federal law, to give them more comfort with that. Then the APS registry bill, that's dead. Well, it's carried over to next year, but we're expecting a letter and we'll be doing a study on that. That's been a topic for multiple years. And so GARS will be working on that this summer. There were some changes in the criminal statute with two bills, one the House, one the Senate, with the change of incapacitated adult to vulnerable adult. This has been a change that's happened in a couple of other states as well. There were two bills dealing with the misuse of a power of attorney for financial exploitation and making that a class 1 misdemeanor. There's also another bill dealing with wills. Senator Obenshain carried this one as well. He had one of the misuse of the power of attorney bills as well, but deals with undue influence. So there were a couple of different bills addressing that area. In the long-term care world, they were, once again, Delegate Watts is very, very persistent, and she was back again this year with a staffing standard bill. Delegate Carr also had one, but they are no longer alive. However, on the Senate side, there is a bill dealing with, and it's going through, dealing with involuntary discharges from assisted living facilities. And in the code, it adds several different provisions that the Department of Social Services will need to include in their regulations that they promulgate, providing protections for individuals who are involuntarily discharged from assisted living facilities. My understanding is this is sort of this, there was sort of a missing part in the law. So for example, involuntary discharges through nursing facilities, there are federal regs and law that you have to file. And then through fair housing, there are requirements, but the ALFs fell in this middle area. So this is seeking to address some of those issues as well. It still allows for sort of emergency discharges, but sets some parameters around that as well. So, and this is sort of the thing I love about session is you learn something new every year. So I think a lot of us were like, we were surprised this section of the code even existed. But Senator Eben put in a bill dealing that withdrew the requirement that basically adult children were responsible for their parents and their care. These are called Filial Laws, and a number of states repeal them with the implementation of Medicaid and the coverage that it provides for long-term care. So this is going forward with an amendment that basically you can still be used in bankruptcy cases. So if an adult child is providing support and assistance for their adult parent, that can still be used. Like I said, you learn something new every year, which is interesting, to say the least. So there is a study, it looks like it's coming out, Delegate Oric, House Bill 234, about with the Secretary of Health and Human Resources is going to look at, going to have to look at consolidating oversight of the regulations for nursing facilities, ALFs, and other congregate living arrangements under a single state agency. So that's going forward. Also, House Bill 917, Delegate Oric put this in, dealing with aging services. And these are those services that are provided through the area agencies on aging, prioritizing services or allocation of resources for individuals with the greatest economic need. And then amongst those with the greatest economic need, then focusing on social need. And those two definitions are federal definitions. And we also have, they're also defined in the Code of Virginia as well. So, and then we, of course, we had the confirmation of 2 of the governor's appointees. So congratulations on the ADR DC and Senate Joint Resolution 13. So like I said, the budget is the big thing that's still hanging out there. I'll just, we, for DARS, there was sort of a big difference in the amendments on the House side and the Senate side, but I'll just kind of touch on a few real quickly. In both budgets, there's language for the Secretary of Health and Human Resources to continue the work of the Elevating Aging Work Group, which was looking at how to structure aging services in Virginia, whether it's a separate state agency or changing how it's structured within the department, or providing more funding, how to elevate that. So we'll anticipating, since in both sides, that some version of that will be in the final budget. The Senate also had language in there to evaluate, having the secretary evaluate restructuring of DBHDS. And I know that they have been involved too with the provision of services to individuals with dementia, particularly through the state hospitals as well. So this one of these amendments dealing with the 1915I state plan through Medicaid. This is a result of a Joint Commission on Healthcare study, but that could be huge for older Virginians. It would require DMAS to develop a plan. 1915I state plan amendments allow states, and they can structure them in various different ways, but it allows them to provide home and community-based services to individuals who may not meet the qualifications for a home and community-based services waiver. In Virginia, we have, for those who qualify for one where the alternate institutional placement is a nursing facility, it's a pretty high bar because we also have a medical nursing need. So someone who may require just assistance with a couple of ADLs would not qualify. So that could be a huge deal for older Virginians. There's also an amendment that would combine. So right now we have separate caps under the DD waivers and the CCC plus for assistive technology and environmental mods. But this budget amendment would allow it so you could combine those two caps. So for example, you have 2 separate $5,000 caps. It would allow you to blend that to be a $10,000 that you could use across. So it would provide more flexibility. Anytime for example, Marcia was talking earlier about environmental modifications, especially with the price of the goods that it takes to do an environmental mod. This would allow individuals to have more flexibility to actually meet their needs as well. And dementia case management funding for just over $112,000 is in the Senate budget for both years. And there's also just over $900,000 for the long-term care ombudsman program for both years as well. So those are just some of the high points, and I'm happy to answer any questions folks may have. And sorry if I felt like I was just talking at you a whole lot.
No, thank you for those updates. And it's helpful. I guess I have kind of two questions. One might actually be more towards George, but the first one is the elevating aging. Where does that stand right now? Because I know that we were pulled into focus groups and work groups, and then I don't think I've heard much. And I don't know if that's just because they're waiting for funding or.
So there was a report that is a public document, and it's on the LIS site for reports to the General Assembly. So that was completed. The work group did not come up with a definitive recommendation. So there were a couple of different options that were discussed, but they did not have a single recommendation as to, this is the way we recommend going forward. There were several different options that were laid out.
Okay. Thank you.
Sure.
Does anyone else have any questions?
Did you have something? You said you had something that might be.
Oh, that was actually it. I just wanted to know where the work group kind of, if they had any recommendations. I mean, the only other question I kind of had was, in general, you spoke about a lot of bills that were kind of killed. Was there any themes that emerged that we should be aware of from just the change in administration or?
Actually, most of the bills that I talked about, I tried to focus on the ones that have made it through. So there were a number of components with the guardianship bills that did not make it through. But I think with the, as far as what the administration is going to be looking at going into the future. So I think it's early on. So at this point, I think, it's sort of, they have to kind of jump into every new administration kind of has to jump into the deep end of the pool. And it's sink or swim. I mean, you're coming in with somebody else's budget. You're coming in with somebody else's priorities and bills. So I think we'll, get a better flavor of, going forward.
Okay.
Catherine, could you expand just a little bit more about the restructuring of DBHDS and folks with a dementia diagnosis in the state hospitals? Can you add anything to that?
Unfortunately, no. It basically the language that was in the Senate budget, and I don't know if it's going to be in the conference report or not. Josh, I don't know if you've been hearing anything. But it basically was going to have the secretary look at restructuring DBHDS. There wasn't a focus on individuals with dementia. I brought it up because, they do work with individuals with dementia, and just sort of as an FYI.
Oh, okay.
Beyond that, I'm not quite sure.
Yeah.
Okay, thank you.
Catherine, I haven't heard any other insights or anything like that, so we don't have much to add on that one.
Yeah.
Thanks, Josh and Catherine.
Sure.
Well, thank you guys so much for giving us an update, and good luck on I guess your last week or couple of days and
fingers crossed. Thank you for having me. It's nice to be here.
Okay, I guess we'll move along then and turn this over to George to give us the Dementia Service Coordinator Report update.
Thanks, Laura. So I'll just start off by making a quick mention. I know Catherine, in her very comprehensive and detailed report, mentioned lots of acronyms that some of you may not be familiar with. So I did send out an updated list of acronyms for dementia and DARS services, including lots of other kind of age-related terms. So hopefully most of those that Catherine mentioned will be on that list. So if you're not sure what CCC Plus is, you can certainly find it on that acronym list. And we'll keep that updated and send that out periodically. And if you ever need it, please let me know. Okay, so for my report, you'll see it's a little bit shorter than last quarter, so it's only covering 3 months, and over the holidays, not too much was going on. Let's see, lots of webinars as usual. Nothing really to highlight there. Yes, the last one on my list was a focus on aging federal partners webinar on dementia risk reduction. And I think that'll be required viewing for anybody who joins the Dementia State Plan work group, which we'll talk about later. It was I wouldn't say there was a lot of new information in there, but there was certainly, if you're looking to come up to speed on what's been happening in the risk reduction space and the modifiable risk factors space, then it's a good overview. I've done quite a few presentations this quarter, some even in person, which is great. I really enjoy getting back up in front of people. Let's see, I guess the highlight was Virginia Center on Aging, their legislative breakfast. They, with the new director, Tracy Gendron, they switched up the format a bit, and they invited Christy Jensen from Riverside Center for Excellence in Aging and Lifelong Health, my colleague Nick Slentz, who runs the caregiver programs here, and me to present on a caregiving panel, which was a really great opportunity to showcase some of the work that's being done in Virginia around caregiving, and also gave me a good opportunity to plug our new offerings, the Dementia Roadmap, and a few other things. So that was a really wonderful opportunity, and I did get some follow-ups from that have led to other trainings or presentations, so that was great. One of those was the Virginia League of Social Services Executives. I presented together with my colleague Chris Miller, who runs the brain injury programs here at DARS. We presented on, they had asked us to talk about the Marcus Alert and how that was being implemented, particularly around people living with dementia or brain injury. So we really tried to make the point that, in the moment, people are not going to really necessarily be aware of what's causing that behavioral presentation. And so they need to be able to respond to that effectively, regardless of what's causing it. So she and I talked through some ways of things like communication strategies and tips to interact with those folks in behavioral crisis. Following that, we did get we offered to do trainings for local APS teams in that presentation, and we got immediate follow-ups from two, Chesapeake and Prince William. So we did those in the last couple of weeks. And the last one was, we thought went so well that we're going to record a version of it and make it available to APS more generally, so they can watch that on demand. So I think we're both a little trepidatious about doing something like that, but I think it'll be a good resource for the APS teams. Let's see, I had an opportunity to testify in support of a bill or two bills in Maryland to create a role similar to mine, which of course happy to support. I will also say that thank you to Josh and Carter Harrison and colleagues at the Alzheimer's Association who've been putting several other state dementia coordinators in touch with me to discuss how Virginia is implementing its state plan, how it comes up with its state plan, all sorts of things. I mean, many states are really starting from scratch here. I'm going to be speaking with somebody from Kentucky either later this week or next week, who really is starting from scratch. They've just created this role and really making it up as they go, I guess. But super exciting that this work is being done in other states, and I'm really pleased and honored to be able to share what we're doing here in Virginia with them. I've done quite a few Dementia Friends sessions and dementia awareness trainings. I did my usual training for the State Police Academy last week, and I will be doing a I'll be attending a conference. It's the Health Occupation Students of America. This is a student-led organization that's in high schools and community colleges across the nation. Their Virginia State Conference is Friday and Saturday in Williamsburg. I'm going to be doing 4 Dementia Friends sessions, 3 for the students, and 1 they've asked me to do especially for the teachers, which I'm very excited about. So I'm going to take an extra half hour and talk to them about how they can become Dementia Friends champions and bring the program back to their schools. And I think that will give us a little bit more continuity than if we have student champions, although I'm certainly going to encourage that as well. But it would be great to have a sort of semi-permanent champion located in schools. So I will give you a report on how that goes in June, but I'm really excited about that. I've been trying to get in with them for the last 2 or 3 years, so it's paid out, which is great. In terms of data, there's nothing new. CMS has not yet updated its chronic conditions data, so we're still working with the 2018 numbers. It's now 2022, so I'm hoping the 2019 numbers will come out fairly soon. But sorry, Kim, did you have a question? Okay.
That was a clap. It looked like a raised hand.
No, I just saw it out of the corner of my eye. So yeah, so hopefully that data will be coming out soon. We are going to, as part of the BOLD Act, we're going to be asking the optional modules on either one or both. I can't remember what what's been discussed, but I think that at our last meeting of the BOLD partners, it was we were going to move forward with both optional modules, the cognitive decline and the caregiving module, again in 2022. So that's this year. So that'll be 3 years since the last time we asked it, which is more or less what we have planned. In terms of collaboration and partnerships, so as an offshoot of that testimony in Maryland, I've been asked to present on, again, what we're doing in Virginia, and they're very interested in hearing about the commission and all the work we've been doing to the, I guess, analogous body in Maryland. It's I can't remember the exact name of it, but their Dementia Commission. And I'll be doing that next month. So I'm very excited about that. Let's see. Sorry. So I'm glad Annette's here, because one of the things that Annette and I have been talking about is how to foster better relations between area agencies on aging and local community services boards, particularly where it comes to folks living with dementia or other forms of chronic illness that might overlap between the 2 agencies, and we know dementia definitely does. So we had an initial meeting a couple of weeks ago with Ballad Health, which is the main healthcare provider in Southwest Virginia, the Mount Rogers Community Services Board, and District 3 area agency. All of those are kind of centered in the Marion, Bristol, Abingdon area. And it was we just led a kind of free-flowing conversation about what folks are doing, and it was really enlightening. And one of the things we learned was that Ballad Health is developing an interdisciplinary medical memory clinic, which is very exciting. So that's the first new memory clinic, dedicated memory clinic in Virginia. Well, actually it's in Tennessee, but it's right across the border in Bristol. That's the first new one in quite a few years. So we'll be adding that to the list of memory assessment centers that we keep. So that's exciting. And we look forward to continuing that conversation going forward, with the hope of maybe not necessarily developing protocols, but at least developing maybe a model of how those agencies can communicate on the ground better in other areas of the state. Okay, I guess grants. So an update on the Alzheimer's disease project initiative. our programs initiative, the ADPI grants from the Administration for Community Living. They had forecast last July that this year's round of funding would be released in January. We're still waiting. So I think the person at ACL was on a webinar last week saying it should be coming out soon, but we will have 60 days once that announcement drops to submit. So I've been working with DARS's new grants person who you may know, Devin Bowers. She was my predecessor as the Dementia Services Coordinator. So between her and I, we've got some great ideas. We'll see whether they align necessarily with the funding opportunity. Obviously, we've been going on what the guidelines were in years past, but we're hoping to put in an application for that. It's a tough one because half of it needs to be spent on direct service, and there's quite a high match requirement, and so making sure all those pieces fit together is not always so easy, particularly at a state level. So I think a little easier for the community-based organizations who are, really focused on direct service. So we'll see how that goes. I mean, we've used them effectively in the past, as you know, to I guess most remarkably to build up the dementia care coordination program at UVA. So, and Riverside has, of course, used one of those grants to do the same. And Solana is a current recipient with the Richmond Brain Health Initiative. So that's very exciting too. And then with the BOLD Act grant, so we're just starting discussions about year 3, which will start in August. I guess the main thing to know about that is that we are moving forward. So even though the Virginia Department of Health has had some issues hiring the brain health coordinator, which is a key component of that grant, they're in constant communication with CDC, Centers for Disease Control and Prevention, who awarded the grant. So we're still receiving funding, and the health department is still working on hiring that person. So we'll see how that goes. The main partners are the health department, DARS, and the Alzheimer's Association. We've been making good headway with lots of our little projects. So all good there. And then the last thing I had on my report is just legislative update. So Catherine's obviously given you a very good overview of what's been happening in Virginia. I did have the federal legislation as well, but the only thing to note is that nothing has moved forward since last year. So I suspect, given the facts on the ground and with midterms coming up, we'll see no movement on any of those bills, unless Josh has some information that might change that view. But yeah, that's unfortunate. There's some good bills in there. And that's all my report. So any questions? All right. Thank you.
Thank you, George. I think if no one has any questions, then we can move into our discussion around work groups and committee structure. So due to the changes in the commission membership, we have several people that we're going to want to figure out which work groups that they want to join. And then also a reminder, if you have printed off George's notes in the back, there's an overview of guidance for work groups and best practices. So just please keep in mind that, we can invite outside people to join our work groups with subject matter experts. And that's something that really helps with the quorum as we're thinking through how we meet, especially if we have to go back in person. But I wanted to give you the good news, which will make this go a little bit faster than usual. There are several work groups, including the training work group and coordinated care work group, the information network and research work group, legislative committee, and we're getting ready to talk about the dementia state plan because it's already been 4 years. I'm not quite sure how that happened. And then the Burfus committee. And right now, Rick Jackson has agreed to continue chairing the legislative committee, and Lana Sargent has agreed to continue with the research work group. And then we have Carol Manning, which is Burfus committee as well. And the two that were open was the training work group, which Kim Kuttner has volunteered to chair. And then the coordinated care work group with Ishan Williams has volunteered to chair. And so I guess, George, my question is, do we need to go through, and I'm going to open this up for conversation, obviously, but just from a procedure standpoint, do we need to vote each and every work group, or can we lump it all together and vote it?
So according to the bylaws, it's your prerogative to appoint the chairs. So,
okay.
So
well,
even
appoint it.
easier. And then you've got one more, the Dementia State Plan Work Group, which Margie Shaver has very kindly agreed to chair.
Thank you, Margie. And we're actually, our next slate of businesses to discuss that particular work group and updates that George can speak to. But I'm going to go ahead and appoint the new chairs for these committees and work groups. And then I want to open up the floor to people choosing to join work groups. I know some of you are already on work groups. If you want to continue with those, that's great. If you want to join additional ones, let us know. And then also, if you're new to the commission, which work groups do you want to join? And I'm going to go ahead and open the floor up.
And if anybody needs an overview, I'll just give a quick overview of what the work groups actually are focused on. Pretty much obvious from the titles maybe, but the Coordinated Care Work Group is concerned with goals 1 and 4 of the Dementia State Plan. So it's kind of the state coordination as well as care coordination for families and coordinating trainings and things for other folks. The training work group is focused on goal 3 of the Dementia State Plan, which is around training, both for family caregivers, professionals, and others like legal and financial professionals. And then the data or the information network and something, so which we shorthand to data and research work group is concerned with goal 2, which is the data goal, and goal 5, which is the research goal of the Dementia State Plan. The Burfus work group has been looking at the 2019 Burfus data, and then the Dementia State Plan work group is obviously focused on rewriting the Dementia State Plan, and the legislative committee is tasked with coming up with our legislative platform each year.
Yeah, and just a reminder to the legislative committee, obviously we have to have that, but from time to time we will create additional work groups as needs arise. So we'll talk about this now as far as which work groups you want to join, but just know that basically every year we kind of go through and figure out what additional work groups or do we have, or which ones are going away. So George, I don't know if it would make the most sense for you to run through the current membership of each work group.
Sure. I was going to suggest maybe we start with the legislative one, because its composition is a little bit delineated in the bylaws. So you, Laura, as chair, appoint 2 members. So you appointed the chair of that. So that's one of your appointments. The members elect 2 others, and then Josh Myers is an ex officio member as the public policy person at the Alzheimer's Association. So maybe we should see if anybody is interested in joining that work group. And so we're still looking for 3 members currently. Let's see.
I think Karen just raised her hand. Karen Darner.
Okay, so Karen, you've been on it before. We had, so the current members were Rick, Karen Darner, Karen Garner, Laura Bowser, and Josh. So So Karen Darner, thank you for being willing to continue there. We could probably volunteer Karen Garner to stay
Since she's
on.
all things, yeah, let's go ahead and just volunteer her. And
You
I'm
could-
happy.
Sorry.
I'm happy to be on it, but am I on it by de facto or can I actually join it?
So you are ex officio, so we could have one more member.
George, I wouldn't mind joining that group, but would I be doing too much since I'm going to chair this other group that is brand new to me? Should I stay away from that since I'm going to be chairing the other work group?
Margie, the legislative committee typically just meets once a year, so I think you'd be safe.
Oh, okay. All right. Okay. Well, yeah, I would like to do that, though. That I do have experience in. So
great.
Okay. All right.
All right.
Welcome. Great to have you.
Thank you.
So as two of those folks are effectively elected by the members, is there any opposition to any of those people joining the committee? All right. So should we take that on acclamation?
On silence, yes.
Good. Lack of.
Okay, so I have Rick Jackson as chair, Karen Garner, Laura Bowser ex officio, Josh Myers ex officio, and Margie Shaver.
Good.
Sounds good.
And we'll look to meet in probably in April, May.
Okay.
Okay, so the next one, let's start with the coordinated care. So the only other person on the commission who was a member currently was Karen Darner. So this work group last year and a bit, we were really focused on the dementia roadmap, which has now been launched. So now we're looking for something new. So we don't have a project as yet that will be decided at the first meeting. Yeah, I don't have any further ideas on that right now. But if anybody else, Karen, are you interested in continuing on that one as well?
That would be fine. That would be fine.
Okay, I see Destiny's hand up. Anybody else interested in joining the coordinated care work group? And of course, you can always join down the track. Ishan, are you saying yes?
He's the chair.
Is that the one that I'm chairing?
Yes, your chair. Sorry.
Thank you for agreeing to join your
So
own.
I think I need to say yes to that. No, I'm George. Yes, I was trying to get anybody else. I was like, come on, people, come on, you can join.
So, Ishan, it's your prerogative as chair of the work group to appoint other members. So are you happy to appoint Karen and Destiny?
Yes, I'm happy to do that.
Okay. We did have a couple of members, so non-commissioned members who were part of that work group. Last time we had Tina Turner of the Alzheimer's Association and Fonda Neal, who is a caregiver and works at VCU. So she's indicated that she's still interested in continuing, and you and I can talk about that. I know Tina's got a new national role, so she might be a little busy, but if anybody else knows of anybody who might be a good asset for the coordinated care work group, please let us know. Okay, training work group. So Kim Kuttner is our new chair of that. Thank you, Kim. Previous members were Karen Garner, Kim Kuttner, Laura Bowser, obviously ex officio. Then we had Denise Butler and Vicki Armstrong from Riverside Center for Excellence, and Chasley Williams, who is a caregiver and also at VCU. She's indicated she would be interested in continuing to do something. She may not have all the time, but I haven't approached Denise and Vicki to see if they're still interested. But Is anybody else on the commission? Annette, you're okay. You put your hand up. Thank you.
What are they currently working on, George?
So again, all these work groups had kind of time limited work plans, and they've all been completed. So the training work group was working on the primary care dementia toolkit. One of my suggestions would be that we focus on creating a training for that to help embed it in the primary care setting, because I know that's one of the challenges that we've been facing in trying to roll it out. So that would be my suggestion.
I'll volunteer for that group.
Okay, and Destiny, you've got your hand up again. Okay, thank you. And Travonia. So Kim, as chair of that work group, would you be comfortable appointing Destiny, Annette, and Travonia Brown Hughes?
Yes, and is Josh's hand up?
Yeah, I think Josh's hand is
Oh,
up.
sorry. Okay, I'm looking at. I keep going back between the spreadsheet and the thing, so I'm not following what's happening on Zoom. Okay, so Josh, thank you.
Thank you all.
A popular work group. Great. Okay, so just as an aside, all of these work groups, I'm going to be looking to schedule those first meetings sometime in the next 4 or 5 weeks. So it'll be at least 2 weeks out. So sometime late March, early April for all of these. The data and research work group. So Lana Sargent is continuing as chair. So current members were Pam Teester, Carol Manning, Margie Shaver, and Travonia Brown Hughes. I think you were kind of an adjunct member. And then we had a couple of members for the public. So Connie Kugel and Fonda Neal was also on this one. So those current members, Carol Manning, Pam, Margie, Travonia. I know Margie. I would say please focus on the state plan.
George, is this the Burfus one you said?
No, this is the so this is the data and research, and so we have been working on ways of improving the contact, I guess, between research and underserved populations. And so we had lots of ideas, and we're still moving forward with some sort of app or some website, some form of facilitating that contact between researchers and members of underserved communities who may not have considered participating in research previously. So that project is ongoing.
And I was not on that group, right?
You weren't, but
No, I was not.
be.
Okay. But we welcome you. The Burfus, the Burfus work group kind of came out of looking at some of the data in our work group. We need, I think what we're tackling this group is challenging. The idea of finding a platform to help connect researchers or even providers with research that's going on across the state that otherwise individuals cannot have access to, right? And finding platforms to do that. So we need innovative ideas, individuals who, certainly have some expertise in how we can connect individuals. We were looking for certainly something that was accessible, right? So anybody with great ideas, that's one of the things. And then the other things we work on is just collecting data. I know it doesn't sound very exciting, but getting some idea of
individuals across the state who and caregivers who are we have some numbers of individuals who have Alzheimer's or related dementias, and that's another very challenging topic to get. But we did just recently get some funding that will allow for a registry that's going to be getting up and running, and so we'll be inviting that individual who got the funding to that work group to work with us. So hopefully they can partner with us as they're developing that out so we can start to get some good numbers because the numbers matter for providing services and things like that. So I correct me if please feel free to add in anybody, but those are, I think, the two big items that we have worked out in this work group. Even if I wasn't chair, I was on it before. And the collecting data part is certainly the hardest, but we were hoping also that the platform that we would be using to connect people with research, we could also collect numbers of participants to people who were engaging in this work. So just it's all really around collecting some information around individuals across the state who might need services that we're not capturing in other ways, right? In the BRFIS data or in other ways. So I mean, lots of innovative thinkers.
Yeah, I'd be happy to join. I was curious, who did you say got the funding to do the registry?
So this was actually one of the postdocs who's working in the Department of Gerontology, Annie. Annie, I'm trying to remember her last name right now.
At VCU?
Yes. And
okay.
It's a kind of a lifelong project for her, but it fits in with what we're doing in the Brain Health Initiative. But she's kind of modeling it after some other registries, statewide registries that are out there. She's just getting up and running. So it's a great opportunity for us to partner with them, right? And what she's doing to think about sort of the bigger picture on that, right? It cannot be research related, but we can certainly collect individuals' information, caregivers' information. She's just getting started. So,
Okay, great. Thank you. Yeah, I'd be happy to join.
Thanks, Ishan.
Thank you. Anybody else? Annie Rhodes, sorry, that was her.
Annie Rose, okay.
And it was BDH funding that she got,
That was one of the mini grants from the BOLD Act, wasn't it?
Yeah, it was just to really, again, try to get, well, we have a great foundation here, as everyone knows, but really just to get a statewide registry modeled off some of the other statewide registries that are going on.
Right. And then the BRFIS work group. So I see Carol has dropped off. She probably no doubt had a patient. So we last met in December. I'll just do a quick, I'm jumping ahead a little bit, but I'll just do the update on that work group. So we met in December and several topics for papers were decided on. Shannon Riley, who is one of the fellows at the Memory Clinic, is taking the lead on at least one of those papers. And I can't remember who's taking the lead on the other, but I think 2 papers are in the works. And at this point, I don't think there's any need for the work group to reconvene for a while until those papers are ready. The only other thing, I guess, from that was that one idea that I'm not sure whether we're moving forward with or not was to do a deeper dive into the data or looking at modifiable risk factors and dementia risk reduction. And I'm going to volunteer myself to take the lead on writing something about that if Shannon can get me the data, because I still think that's a really interesting piece, particularly as it could help inform what we're doing with the dementia state plan. So, which I will, Laura, if you're happy for me to move into that.
Yeah, go ahead.
Okay, so
big item.
Yeah. So the Dementia 2023 update. So as you know, the Dementia State Plan update. So as you know, we try and update the state plan every 4 years. And it is hard to believe that it's almost been 4 years since the last round. That was, I guess, kind of occupied my first year in this role. And since I was new, I wasn't terribly comfortable on doing a really root and branch, tearing it all apart and putting it back together. The way I started was just to look at other states' dementia state plans and come up with a grid to see whether things that were in other state plans were included in ours, and see if there were any gaps in ours that we should be filling. I guess one of the main things we did was to try to reevaluate many of the recommendations in terms of a public health lens. And this was early days in the risk reduction conversation. I guess the day that research was just starting to come out around, for example, controlling high blood pressure and how that reduced your risk of developing dementia. So there is a lot more research on that now. So that's something we definitely want to consider, and I'll talk more about that in a minute. And the other thing we did was include dementia-friendly efforts as part of a broader dementia-capable structure. So this time, so I've been talking to Laura and Margie about, I guess, a bigger attempt at reimagining the state plan. So I'm sure that some of it will emerge intact, but there are probably areas that could see some consolidation, and there's certainly some areas that we've achieved that maybe no longer need to be included in the plan. But we had thought that it's about time to engage a much broader group of stakeholders. So we'd floated the idea of holding a dementia summit early next year to get broader public input into the state plan. So I guess one of the topics for discussion is, do we think that's a good idea, and are we happy as a commission to move forward with supporting that? So I've reached out to the Virginia Governors Conference to see if there's any ways that we can align with that. If they're going to hold one next year, we don't know yet, but it might be an opportunity to align with that, or maybe something else. Just I guess a review of what we did in the past. We had taken a bit of a road show. We went to we held public listening sessions in 5 different areas of the Commonwealth, from Big Stone Gap to Fairfax to Virginia Beach and Richmond, and gosh, I'm blanking on the last one. Maybe we only did 4. I thought we did 5.
Roanoke.
Roanoke. Oh God, sorry. I have got Chris and Annette sitting right in front of me. So yes, so at those listening sessions, we had the chair of the commission, who was Lori Filippo at that point, and local members of the commission and the Alzheimer's Association helped arrange those sessions everywhere, apart from and the final one was a full commission meeting, which was then followed by a public listening session. So I think our experience was that while we had a lot of engagement at some of those, a couple of them really we had very, very limited engagement from members of the public. And while they were still a valuable exercise, and we did learn much about, I guess, what families are dealing with on a day-to-day basis, there wasn't a whole lot that we were able to take and directly inform the state plan with. So that was one of the reasons why we were considering a dementia summit as a way of getting a much broader cross-section of both professional and family input into the plan.
Yeah.
So is that something that folks think is a good idea generally?
And I can just add a little bit, because I was on the work group for the last state plan, and I agree that we did the listening sessions, and by and large, there's a little bit of a disconnect of what the state plan's purpose is with what people were coming out to speak to. So people would get up and they get really, really tactical about their personal experiences, which really has nothing to do with the plan as much as, we want to be able to help individuals. So we found ourselves walking away with people frustrated that they didn't feel heard, and us not being able to do much with the feedback or input, because in some ways there was a lack of education out to the public on what the state plan and its purpose is. And so I think one of the ideas for holding the summit, and granted the summit would take a lot of work, is partially to educate people on what the plan is and what it isn't, and why it's structured the way it is, which is very broad, so that we have the ability to serve and sort of pivot as needed when it comes to legislation or needs, but also so that we can have the conversations that we need to have with people once they are educated about what does this look like, what's the next level, how do we level up.
Yeah, thanks, Laura. That's very, very true. And I think that disconnect is really interesting. So when we had the listening sessions, one of the guidelines for us was not to comment on people's individual comments. And so we had the 4 or 5 of us sitting up in the front, and somebody would be telling a very heartfelt story about their personal experience, and we couldn't respond. And so it didn't feel quite right, I guess. So we want to make a way of better enabling, it's a two-way flow, I guess. Better education about the state plan to the stakeholders, and then a better way to facilitate input from the stakeholders. And yes, it is a big undertaking. Yeah, sorry, Annette.
I was just going to ask about the format. Are you hoping to do in person? Are you hoping to do virtual or a hybrid? Or what is your mindset on that? Because I know we had a fairly good group here in Roanoke, but if we didn't capture the comments from the people that we needed, how would we envision getting to them this next go around? And maybe that would be through virtual. I'm wondering, and maybe you haven't gotten that far.
Yeah, so this will be one of the tasks of the first meeting of the work group, is going to be what sort of structure are we looking at? We're going to need to draw up a list of stakeholders that we want to invite to this. And then I think decide whether it's going to be in person or virtual. I mean, I vote in favor of in person, but we would need some funding to support that. I think we can do that as part of the BOLD Act grant. It certainly fits in with the objectives of the plan. I guess I'm going to unveil a potential big change to the plan. The National Alzheimer's Plan, or Project ACT, set up a National Alzheimer's Plan. They, in January, added a 6th goal to their plan specifically around dementia risk reduction and modifiable risk factors, addressing those modifiable risk factors. That was the first new goal they've incorporated into the plan since its inception. So clearly a big, important piece that maybe we need to consider adding a 6th goal. So we have some recommendations around risk reduction, but as I said, the research was really in a much earlier phase when we last updated the plan. So this gives us an opportunity to think really strategically about how we want to incorporate risk reduction and modifiable risk factors, whether that's through a 6th goal, or whether we think it can be adequately addressed under the existing goals. And maybe some of those existing goals need to be rejigged as well. So those will be topics for the beginning, but I think I think there's plenty to engage potential stakeholders around, particularly with that discussion of modifiable risk factors and risk reduction. I mean, that affects everybody, right? It's not just people living with a diagnosis and family caregivers. It affects each and every one of us living in the Commonwealth. So I think that'll be a much bigger draw.
So I have a question really quickly about the format. George, you were talking about this dementia summit, and I know I've been a part of the dementia work group, state plan work group in the past, and so I've seen different iterations, but I'm really curious. I like the suggestion that Laura gave about educating all stakeholder groups about what the dementia state plan is, even if we've participated in it before. It's like have some kind of onboarding about what this looks like and why we need feedback from stakeholders, and really be very specific about, like, we need to have something to present to say, we only want you to give us feedback about this, you know, like, and what do you think about this? So that they know the scope of what we really want to hear about, so people don't feel like they're not being heard in that way. Because I think that gets tricky, you know, working with the broadness, as we know that this plan is, it kind of can get tricky about what are you going to do with this information, and how is it going to be incorporated or not. So just really being clear up front, I think, about our goals for what if we're going to do a summit, what the goals are for the summit. But in this summit, can you think about like having a large open session where we do that education, you know, like onboarding of everybody, get everybody on the same page, and then maybe having breakout groups for different stakeholders to go into different smaller rooms to kind of have those discussions targeted toward one of the goals, that maybe the work group has already come up with some preliminary ideas of what that would look like, but then it'll be a lot more targeted and focused. Is that, I'm seeing smiles, so I don't know if this is like what you always do, but I just was trying to throw out something to help, you know, for me to understand like what that would look like in a summit versus several different listening sessions.
Yeah, thanks, Ishan. So that I think the smiles were about the work group hasn't met yet. So much of this is academic at this point, but it's also, this is new territory for us. This is something new. We have not done something like this in the past here in Virginia, at least around the state plan. But that structure you mentioned is very similar to what I've been thinking. So have a plenary session where it's really about educating broadly about the state plan and setting the landscape for each of the goals, I guess. So what's been done, you know, where we've achieved some traction and some forward momentum, and then looking at these potential new areas for inclusion into the plan, and then splitting out. And so I would, you know, it sort of lends itself to a hybrid model or a virtual model, but I know folks, you know, there's so much more that happens when you're in person. So maybe we think about having an initial session, which would be that education piece, and maybe some initial discussions in a one-day in-person event, which then those breakout discussions continue virtually for maybe a week or two to hammer out some actual language, or at least something approaching language that then the work group itself can hone into a plan. At least those were my initial thoughts around it.
I think a couple things we're going to have to do to begin with is actually define what the summit is, and I'll decide exactly what it is we're going to do. And then after that, we would define define the stakeholders, and then define the format. I think when we talked about it originally, we were really hoping I mean, we were throwing out ideas like crazy, just, like we could do this and we could do this and we could do this. That it would be an in-person thing, maybe a one-day thing or whatever, is what I personally would hope what we could do. Once we define these other things, we may decide that that's not what we want to do or not the best way to do it. But I think right now, the way we can look at it is we're just kind of wide open, and it's very exciting because we can determine what we want to do with this based on what we think we need to do with this. And Ishan, we would love to have you on this work group.
Well, I just wondered if all the chairs were already a part of the work group, because it seems like the chairs of our work groups have goals that are associated with the dementia state plan. So you already kind of have us, I think. Like, I just assumed that we were already a part of it, but
Well,
that's just the the way my mind works, because I think we will have to generate a list of other stakeholders and stuff like that. But to get started with a small group to just I don't know, yes, count me in. I'll just say that.
I agree with Ashan that it's possible that maybe the chairs or some people in the work groups should be a part of this group, because at least if I'm hearing your vision out, it makes sense. Summits are typically used to set a big agenda, for the next big thing that's happening. So this makes absolute sense if we can get it going. It's worth all the effort, I think. But it also would make sense for the work groups, to have these breakout sessions that are specific to the stakeholders that match those groups, right? And we even talked about it in the early stages of the data research group, holding some sort of conference or summit in some way to get feedback. So I could see that it would be beneficial, and maybe that is the structure, is what is being recommended here, is that it is around the state, the specific areas of the state plan that fit within those work groups. And then those work groups take those out into separate breakout sessions that meet whatever stakeholders fall within those groups, to get feedback that helps set the agenda, right, for the next. And then those, of course, chairs would be responsible for taking whatever comes out of those work groups back, right, that we would be using to formulate the state plan. And so it could see a structure certainly fitting around that could be really beneficial. So I didn't mean to create more work for all the people who are chairing those work groups, but it does sound like somebody or some lead from the work group should probably be at this one, right? If we decide that that's the structure, that would best fit.
No,
I like the idea.
I love that idea.
Me too.
For a lot of reasons, because I feel like we did the last work group or last plan, we did a little bit in a vacuum. And so then there was like this lack of educating the work groups. And then again, we're trying to figure out how to educate the public. So I love that. I think that can also really strengthen the work groups as a whole. And figuring out, what do we want this education piece to look like?
I also think that there's some aspects of the state plan that don't matter to all stakeholders. And so by breaking them down into little bites, we might make them more relevant. Meaning, that certain aspects of one plan will only maybe speak to a couple of stakeholders, and what are those stakeholders, right? And we get them engaged for that work group. So maybe, certainly the over-education is helpful, but if we break it down into little bites, people might be able to connect with the state plan, on a personal level, because it matches, their need.
Yeah, what they need.
Right. And I think we saw that too with the listening sessions. We'd have like doctors come and speak. And then we'd also have people that actually do the work for a living. And then we had the people that were living it, and they were all just kind of talking over each other. So I think it makes total sense that we have it kind of parsed out so that people can plug in where it's relevant.
Yeah, those are all super suggestions. And we didn't have a set structure for this work group, but I think it does make absolute sense to at least start with the work group chairs as members. If anybody else is interested in joining, please let me or Margie know. But I think that would make a good beginning, at least. And the other, so one of the other goals of the summit more generally would be to raise the profile of the state plan overall, right? So many people don't know it exists at this point, and so we want to raise the profile of it. And having a big public summit would be a good way to do that, I think.
And don't we have a marketer on here? Like, isn't there a marketing person who's
Margie?
Yeah,
Margie.
Margie's
You can
our-
put those skills to great use. Get us a TV ad. No, it's not.
Listen, I've been thinking about some of that very same thing. That's the same things that you're talking about. So
I'd be happy to help in any way that I can. My whole thought about whether we wanted to do that hybrid approach is, as I work, my position with DBHDS is statewide, and I work with people like George was referencing the meeting that we had with individuals that were far Southwest Virginia. They may not be able to travel to attend a summit in person, but certainly have lots of input and lots of great resources and lots of vision for where they can take things. And so that was my thought about making sure that we make sure that everyone is seen and heard, whether they are in the Charlottesville, Richmond, whatever area, or they're in the Marion area or wherever in between. So I'd be happy to kind of pull in that rural piece. And
great, that would be wonderful. And particularly with your connections in all these areas, that maybe there's an overall summit, but there's little bitty, like you said, hybrid ones in other areas. If there's ways that we can go to them, I don't know, maybe there's not, but these are the things that we talk about and say, how can we take it to them if they can't get to us?
Yeah.
So that'd be terrific.
All right.
And this all sounds great. The only other thing I was going to add, George, is it might be helpful at some point to have Carter give like a 15-minute overview onboarding for this work group. I know that when I started, I was really nitpicky reading every line, and he was able to sort of reframe the reason it was written so broadly. And I think that would be helpful as people kind of join.
Yeah, that's a great idea. And I was thinking we could also tap into the experience of other states that have held something similar. And we would want to do that early on. So.
Yeah, I think that was, George, my next question. And I apologize, I have to jump off the call, but I was curious about the timeline, because if I have this correct, the SGS is going to be back in Virginia in 2023, right? We're 2020. And we represent, there are a lot of people from other states that come, and that may be an opportunity to hear from other states who, I know we've had a presentation once before about our plan at the conference. And so I just didn't know if that could be a vehicle as well to kind of get some additional information from what other states are doing, but just wanted to point out that I'm pretty sure it's going to be back in Virginia in 2023, but that's April. So I don't know if that's late or, where we would be in the timeline of this process.
Yeah, so I drew up a preliminary timeline. Just so the beginning and the ends of it are obviously set. So the state plan, the updated state plan will need to be published October 1st, 2023. So that's our hard deadline. It will need to be, the final draft will need to be ready for the commission to approve in September 2023, that meeting, that first quarter meeting next year. And then obviously we're here today, so we need to start from here. So looking to have the first meeting this month. And then I penciled in April, May, could be earlier, could not probably be too much later than May next year to have that summit, in order to then pull everything together and get the plan ready in time for the commission to approve it in September. So that might work in terms of aligning with the SGS conference.
Yeah, we'll have to determine pretty quickly if we want to do this at some type of facility, because that probably would have to be reserved right now.
Yeah.
Well, I think that was the thought of the governor's conference too. George, was that the other one that you were hoping to link with too? Yeah, because they already have reserved space. That's the only reason I threw out SGS, because we already have reserved space. But to get into that program, I think is a whole another situation. But happy to help out with SGS, connections if we need to. But thanks again, Margie, for leading that really important group.
George made me do it. But that does bring me to one of the things I was thinking about, George and Laura. Do you think it would be a good idea for the three of us to sit down together before we meet with the work group and try to figure out some of the basics of this, so that when we have our first work group meeting, some of these things, it won't be a total meeting of trying to decide everything or not, and possibly hold my hand to get started on this, where I could see know a little bit more about what you guys did before and what it is we really want to do here. I am more than willing to come down to Richmond and spend a day or two or whatever we need to do to just kind of hash some of this stuff out before we actually get started with everybody's time.
Yeah, I think that's a great idea.
Yeah, I do too.
So I'll be in touch, but we'll try and meet. Probably,
yeah. I mean,
definitely not this week, but
yeah,
next
I could
week.
do it as early as next week, a little later in the week, but yeah.
Okay, thanks, Margie, for suggesting that. That would be good.
Okay. So I think we have worked through the work groups and who's on which work group. George, do I need to approve this, or is it just approved?
No, you've made the appointments. It's all good.
Okay. Perfect. Well, with that, I think we should move on to our next line of business, which is the work group and committee reports. George, you kind of did a little bit of the BRFIS for us since Dr. Manning isn't here. But did you want to go ahead and share with us the coordinated care work group?
Yeah, so I just briefly, I know Sarah have joined us, so I don't want to eat into their time, but the coordinated care work group, as you know, was focused on the dementia roadmap. We kind of soft launched that at the Virginia Center on Aging legislative breakfast. And then it went up on our website, I guess the last week of February. So it has been downloaded quite a bit already. I had preliminary numbers, but they were only from the first few days, but it was certainly getting lots of views, which was great. I've had several requests from folks for printed copies. I'm meeting with VDH today, or not today, sometime this week to come up with the final numbers for printing and give the go-ahead for that. That's being supported by the BOLD Act grant, which is great. I think it's going to be somewhere around 10,000 copies initially, which will be mainly made available to area agencies on aging, depending on, I think we'll either use something along the lines of the funding formula or population formula, so that they're not all going to get the same number, but they should get enough for their constituent. Well, they won't get enough, but they should get relatively a good amount. And then I'm going to reserve probably 1,000 copies for folks who have requested them for me. and a few other organizations who would like to have some as well, including the association. So that, I guess that's my report. It's and released in tandem with the Dementia Home Safety Information Toolkit. So both of those were adapted from publications developed by Washington State's Dementia Action Alliance. I've been in touch with them on an ongoing basis. I last spoke with Lynn Court, who is looking after dementia-related stuff in Washington a couple of weeks ago, and maybe last month. And she was very positive about what we had done. She said since then, we were kind of trailblazing in this area, because since then about 13 states and a couple of foreign countries have asked them to be able to adapt it. So I suspect you'll see roadmaps appearing in many states going forward, but I'm glad that we were in the vanguard. So thanks everybody on that committee who helped with that work. It's going to be a really valuable resource for families.
Thank you. That's awesome to hear, actually, because I know that was a lot of work, and it's wonderful to see that other states are doing it, because it was, I do remember you brought us to Washington and we were like, what is this? But it was a really fun project to work on. Okay, well, so we have our guest here. So we have Sarah Link, who's the director of No Wrong Door, and Sarah Stowe, who is project coordinator with No Wrong Door. I'm excited about this presentation. I mentioned a little bit earlier, but they weren't here, that when I first started on the commission, I learned so much from their presentation, and we have so many new members. So I'm excited for you all to hear, and it's just great to have a refresh as well around all the different things that are available within the state. So without further ado, I will turn this over to the Sarahs.
Yay, thank you so much, Laura. And thank you so much, George, for asking us and inviting us to come to the table. And happy afternoon. And I know you're hanging in there with a long Zoom, so we're trying to make this interesting, especially as we get down to your final hours. So first of all, I want to thank you for the first time that I was able to present our work. And I would have to say that we are definitely evolving. So it's really exciting to present some of our new and exciting work. And I'm super stoked that Sarah Stowe will be able to present for you some of the more tangible work that we're doing in this space. So when George brought this opportunity to us to present, we did a little bit of brainstorming. And so we wanted to make sure that we keep today's presentation really focused on that caregiver. So later, after I give some of my remarks, we're going to meet our caregiver, Rao. So he is actually an individual who's come into our system. So we'll step you through that. So Sarah, if you could cue up our presentation, hopefully we can step everybody through, and we'll make all of the slides available after this. So if you have any questions or follow up, Sarah's actually developed a flyer with some additional information that would be helpful, I think, to this group, just some videos and some really short snippets of micro learning. So I'm going to go ahead and just quickly step us through the next slide, which is our agenda. So I'm just going to give us some brief highlights about what No Wrong Door is, just to frame the discussion. And then I'm going to ask Sarah to give us the more tangible innovations. So what are those supports for caregivers? Let's meet the caregiver. We're going to speak to some of the tools for navigating those supports, and specifically some of the way that our partners work with the system. And then we're hoping to kind of hear from you, have a facilitated group discussion about some of what you've heard, and then learning from you, maybe some of the things that we need to be thinking about, and then we'll do a quick wrap up. Next slide, please. So many people ask, what is a No Wrong Door system? And the exciting news is that it's a federal initiative. So it exists in all 56 states and territories. And this initiative exists under the Administration for Community Living. And they actually partner with 2 other federal agencies, which includes the Centers for Medicare and Medicaid, as well as the Veterans Health Administration. And the way that this slide depicts it, it's a way for organizing a system, and a way that really thinks about a philosophy about the person being at the center. And more specifically in Virginia, the way that we organize it is around the ACL's framework for thinking about a one-stop coordinated system, a network of partners that have a standard process for accessing services that's both objective and person-centered. So as you can see, as depicted in this slide, it's a way that we're organizing this community and network of community-based organizations to more holistically address and better serve individuals. And this, includes individuals with disabilities, older adults, veterans, their families, and caregivers. Next slide, please. So as I noted, No Wrong Door is very much a systems change effort, which quite frankly is a lot to consider and unpack. But to try to break this down a little bit, we do this by using our existing infrastructure. So we use existing organizations, resources, and supports, all the folks that are already doing this work to improve access. And we think about how to organize this better. So in Virginia, we have an infrastructure for streamlined access that includes our resource database, which is a public-private partnership between Virginia Department for Aging and Rehab Services, and we're considered the state unit on aging, and we work very closely with Virginia Navigator. So we operate in this space for utilizing their suite of websites, which includes over 27,000 program services and resources. And in addition, we are now partnering as well with 211 Virginia, so we have access to 2 statewide resource databases for our efforts. And then second, we're housed outside of a Medicaid agency. So DARS is a standalone agency, and we act as a statewide convener and lead entity in all aspects of the No Wrong Door initiative. And then third, we maintain a statewide person-centered standards for doing options counseling. And this is an established approach to services that really respect the rights of individuals to control and make the decisions based on their own unique lives. And Sarah will tell you a little bit more about this later in our presentation. And finally, one piece of information that really comes to mind with our work is that it's a local initiative. As much as it rolls up to state and federal work, it's really locally led by our area agencies on aging as their regional advisory groups that meet and really help guide that infrastructure for outreach, marketing, and local activities. Next slide, please. And we have a number of really exciting strengths with our work. We're actually in a space with other statewide No Wrong Door systems and constantly learning from each other through our partnership with the ACL. And some of our strengths really include, again, that local lens and having our AAAs as the local points of contact as the partner agencies. So partner agencies can include oftentimes those contractual relationships that AAAs already have, such as home care agency, transportation services, as well as some non-affiliated AAA agencies that could be community partners just interested in helping to streamline access to services across their communities. And throughout the Commonwealth, we have over 228 No Wrong Door partners, which means that we operate on the same technology platform. And this includes over 120 local departments of social services, adult services, and adult protective services staff. So to date, we actually annually serve about 70,000 unique individuals that are all connected through our resources and system. And we have about 650 No Wrong Door systems users, and these are all trained professionals in the space for making connections. And we also have well over 92 certified options counselors statewide. If you're interested in seeing a complete list of all of the state partner agencies, you can go to our No Wrong Door Virginia website under our map section, and you can find that listing there. So next slide, please. So in a nutshell, No Wrong Door systems really help support individuals to make informed decisions, exercise control over their long-term care needs, and achieve their personal goals and preferences. And the No Wrong Door initiative initially kicked off in 2005, which included a legislative study. And this identified the No Wrong Door philosophy as being a benefit across the Commonwealth. So oftentimes we refer to our work as very much a public utility. Next slide. So while I'm going to refrain from reading the slide about all of the benefits, it's important to note that the state and the federal government and private sector have invested over $17 million into the Virginia's No Wrong Door initiative, which has had a number of benefits that were realized both for Virginians and for partner organizations that utilize our technology platform. Next slide. And some additional benefits are highlighted on this slide as well, which means maintaining a secure community-based record on an individual and for streamlining access so that the individual can receive and partner organizations can get electronic referral on the network without the individual having to tell their unique story multiple times. Nationally, No Wrong Door initiatives across the country are really moving toward an integrated healthcare and social supports model and creating an effective model for better serving individuals through that lens of the social determinants of health and measuring quality of life. So as we see these trends emerging across Virginia, we have very much taken a step into this direction as well with a launch of our newly designed person-centered portal on our Virginia Easy Access website. So I'm going to now hand the presentation over to Sarah Stowe so that she can tell you a little bit more about some of the key features of our Easy Access website and so that she can also introduce you to our caregiver. Thanks, Sarah.
Thank you, Sarah. So I will start off by kind of walking you all through our person-centered portal called Easy Access Virginia. And so it can be visited online at easyaccess.virginia.gov. And the portal is really designed to be a place for visitors to explore and engage with resources in Virginia and beyond. The homepage is really organized around factors that influence quality of life, specifically the social determinants of health, and visualized as a wellness wheel around the sun. So you'll see that clicking on any of those topics will allow an individual to access curated articles, community resources, and links to information. And the portal offers the portal now offers integration of several important pieces of No Wrong Door, statewide information and referral system, all coming together to support Virginians. So for example, you'll see that we have a circle in the right-hand corner around our live chat feature, which is powered by Virginia 211. So it allows individuals to access a trained 211 call specialist 24 hours a day, 7 days a week, 365 days a year. And it's located on every single page of our site. In that right-hand corner so that any point throughout the visitor's experience, they can easily contact a live person. So the second facet of this site that I just wanted to orient you to before we meet our caregiver is the No Wrong Door partnership with Virginia Navigator, specifically on a couple of tools that we have here. So we have the Service Finder tool where we're able to connect individuals to over 27,000 community resources that Virginia Navigator manages through their statewide resource database, as well as our Caregiver Tech tool, which offers a curated database of products, technology, apps, all designed to help caregivers. So next up, we have Rao. I want everyone to meet Rao. So he is our caregiver persona that was put together by our home and community-based work group in collaboration with IBM Watson Health. Rao is a 45-year-old caregiver to his mother, who we'll name Shirley for this example. And she's been diagnosed with early onset Alzheimer's. He's single, has no kids, and is a college graduate. He's really feeling stressed, exhausted, a little frustrated, maybe even a little bit burdened, but he also really feels that sense of meaning in his role as a caregiver. Rao also is struggling to balance his career and his role as a caregiver, especially when it comes to finding services. And he's feeling a little bit overwhelmed. So he's seeking services around caregiving support, assistive technology, respite, and he may even benefit from options counseling. So we'll take the next few slides to kind of orient how some of our self-directed tools can help him. So we'll revisit our Virginia Easy Access site where Rao can start his journey in researching and gathering information. So of course, he can use any of those icons up there that relate to the social determinants of health, or he can use some of those interactive tools that we talked about. So let's look at how Rao would use the service search tool for his particular situation. So we know from his introduction that he's seeking a couple of services, especially when it comes to respite and caregiver support. So by accessing the service search and tools page, Rao is able to input the locality that he and his mother live in and select caregiver support and respite as one of the topics. Then he'll be matched with organizations and programs that serve his mother's area. One of the resources that Rao mentioned in a couple slides ago was respite services. And so we see down in your right-hand corner that the Virginia Lifespan Respite Voucher Program is something that's available to him. So he's able to see, able to get connected quite quickly to a program that's right in his area and actually across the state. So Rao is continuing his search. He's really just kind of gathering some information right now. And so he's going to check out the Caregiver Tech tool right below it. The Caregiver Tech tool is an interactive tool designed specifically to assist caregivers in locating websites, apps, devices, products, all that may help support his mother and himself. So he can also look up any disease-specific information, self-care tips, family coordination resources, assistive technology, and a whole lot more. So we'll continue on his gathering information journey, and we'll look at the caregiver or the social engagement finder. So as we all know, social bonds have a huge impact on your health, and just another one of our interactive tools, Rao is going to use the social engagement finder. So this is going to help him locate resources that can connect people. So specifically focusing around telephone reassurance, friendship cafes, companion services. But specifically in this example, Rao was able to locate an adult day facility that's close by and in his area that can help with both respite services, but also that social engagement so that his mom can have that meaningful social connection and engagement throughout this process. And of course, throughout this entire process, Rao is able to connect through Virginia 211's live chat function. Of course, he can do that via the live chat, but he also has the option to use the toll-free number that is there as well. And the toll-free number is actually available in more than 200 languages. And of course is available 24/7. You'll always be connected with a real person who is specifically trained on the No Wrong Door system as well. So next up, so of course the live chat and the toll-free number are not the only way for Rao to connect to different organizations. He can also do that through No Wrong Door's direct connect function. And he has the ability to self-refer to any of those opted-in organizations. And so this is something that is fairly new to our system, where individuals can self-refer using Virginia Navigator or any one of our interactive tools on the site. Of course, the live chat function, all of those ways will get you there. And organizations who opt in will have those referrals go straight to their queue. So it's just another way for individuals to easily access the programs and services that are a part of No Wrong Door. All right, and then of course, part of that is person-centered options counseling. So this is an interactive decision support process where individuals are supported in making long-term support choices. The focus of this process is really looking at the individual's unique preferences, strengths, needs, values, and circumstances. And it is provided by individuals who are trained and practice according to the Virginia statewide options counseling standards. So our AAAs, as Sarah Link mentioned earlier, are our No Wrong Door local leads, but they really also lead the charge in person-centered options counseling, along with our Centers for Independent Living. And so this is really just taking a holistic look at what the individual is looking for. So in Rao's case, looking beyond just maybe respite or caregiving support and making sure that his mother's needs are met holistically, more than just what he's mentioning. And so all of those training modules that are listed here, there's 5 of them, are available on our No Wrong Door training platform, which I'll show you just a little bit about. So our training platform offers all 5 of those person-centered options counseling modules, and they are free and open to anybody who is interested in taking those. But it also, the training platform also has assistive technology trainings and our newest trauma-informed care course. So it's constantly being updated with new trainings and new information. So to kind of wrap up Rao's journey, I know that we've had a lot of information kind of thrown at you all at once. So this kind of sums up some of those paths. So Virginia Easy Access is kind of what we started with, our person-centered portal. And that was just one of the paths that Rao took to locate services and supports for his mother. And as you can see from this journey map, he kind of started down at the bottom, looking at more of a self-directed path with Virginia Easy Access, the Direct Connect feature, and receiving supports that way. And of course, the 2-on-1 live chat function throughout the whole process. But we also have our network of partners that Rao can go through and gain access to any of those 27,000 programs and services that are part of our system. And he won't have to tell his story over and over again. It's a streamlined system, and referrals can be done in the system. He can also receive options counseling through any of our AAAs or SILs, and receive assistance that way. So in closing, we've been able to meet the unique and individual needs of Rao through our person-centered resources and that streamlined access to services and supports. So at this time, I will turn it back over to Sarah Link.
Well, thank you. I also want to, I'd be remiss if I didn't mention one of our new and exciting partnerships as a result of the COVID-19 is that we've partnered very closely with Virginia Assistive Technology. And as Sarah Stowe mentioned, we have this really exciting feature now for the social engagement finder. But what we're also working closely with VATS with is any type of assistive devices that would help somebody who might self-identify as being isolated. In fact, we've been working very closely with their occupational therapist, and we have a direct number to that occupational therapist that will provide an individual caregiver or an individual who self-identifies for wanting social engagement with some, tools or gadgets or different devices that could help support them. One of our most exciting ones that seems to be the hot topic right now is our robotic pets. I'm missing Fluffy right now because Fluffy is like a real cat and she actually purrs. And so we're finding that so many caregivers and so many older adults who are working with the different individuals at AAAs are really loving these robotic pets. And the exciting news is probably many of you already know is some of these robotic pets are evidence-based solutions. So that's really, really exciting. And they're actually a lot cheaper than I thought. So it's pretty amazing. They're almost real cats, but you don't have to deal with the litter box. Anyway, I want to pause. We've thrown a lot of information out there for you, and we'd love to hear your comments. Do you understand? Do you like it? Is there any way that you can think about helping us promote this work? So if you want to either just unmute yourself or throw anything into the chat, Sarah and I will absolutely be happy to hear your thoughts or address any questions.
Sarah, I'm going to jump in. It's not really a question, but I just wanted to let the commission know that I've been in contact with VATS, Virginia Assistive Technology, and we've been talking about putting together some technology kits that could be housed at AAAs to show people what is possible, because we know there's so many technological fixes that can help support families caring for somebody living with dementia in particular, and the robotic pets are figure highly among those, but also just things like door alarms to prevent wandering, and those easy technological fixes that maybe people don't always think about. So that's something that I've been discussing with vets, and it's an ongoing discussion, but I'll keep you posted on how that goes. So just thank you, Sarah, for reminding me about that.
Yeah, and I'm happy to, George. I can share. We've got 3 kits that we've worked on with VATS, so maybe that would be like a springboard for thinking about, how these could be put together specifically for this area. So I'll send that out to the group as well.
Thanks.
Any questions for Sarah or Sarah? Well, I would just like to say thank you so much for presenting, and so much. The program just evolves. Like, I'm amazed how much it's evolved even since the last presentation. So I loved hearing the updates, and just kind of walking through that user experience was really, really helpful as well. And I do think it's something that in our work groups, we can have discussions around how do we leverage this and how do we get the word out. We're in a similar situation with a lot of the work that we do. It's just how do we get this in front of the people that need it the most. So any way we can partner, I think would be wonderful moving forward. And I don't know if anyone has any questions, but I do know that next time I hope you're in person, and I will request a robotic cat.
Actually, I wanted to tell you, this was terrific, by the way, but today I got a letter in the mail from the ALS Association, and they were asking for donations specifically for robotic pets for people. And I'd never seen the actual things. They just had photographs, but I thought at the same time, I'm game for a robotic dog, I'll tell you. But it was great because the cost, you looked at it first, and for a first-time person for ALS, and I'm not that, but that would be perhaps a costly item. But then when you have something where you're talking about it and you're explaining how it's used and how it's acquired, that is terrific. And that's the kind of information I think that people need to take a chance and do something like that. Big help, big help. Thank you very much.
Any other comments or questions? Well, if not, thank you guys so much for joining us and presenting. It was wonderful to hear from you, and hopefully we can continue to be in touch and partner.
Thanks, guys.
Thank you so much. And we'll send the presentation to George, and we'll send also our VATS information as well. So we look forward to any opportunity to continue to partner.
Thank you. Take care.
Bye.
Okay. Wow. So I guess we're actually getting near the end of our meeting. I wanted to quickly go over the upcoming meeting dates. So our next meeting will be June 14th, and then followed by September 20th, and then December 13th. The assumption is they will be in person, but we will let you know if that for some reason changes. And then I guess I want to open the floor for new business. Does anyone have anything? The only thing that I wanted to bring up briefly is that the Reason to Hope breakfast, if you are in Richmond, is actually going to be in person this year for the first time in 2 years. So they are actively trying to fundraise and plan for that. So be on the lookout if you are in town, or if you want to reach out to your area Alzheimer's Association, because I know that they are planning these in person. And I think that would really support them, because I know they took a hit the last few years with everything virtual. All right. If there's no new business, George, I think we're adjourned.
Sounds good.
All right. Thank you all. Have a great day.
Thank you.
Thank you, Joyce.
You're welcome. I didn't want to say too much, but we're still recording.
There we go.
All right,
Yeah.
then.
Thanks, Joyce. Are we still doing that spreadsheet?
Yes, let me send it to you. I'll send it to you as soon as we finish.
All right, thanks.
Have a
I'll
good
get
one.
that